Welcome to Module 7. It's about the RIS, function, benefits, and communication. And again, please note that this video is for general information only. You shall not make decisions relying upon it, and you have always consult the laws and regulations about the actions you perform. RIS is abbreviation for Radiology Information System, and as its name describes, it is dedicated to the radiology. In the very beginning, these systems were just replacement of paper, notebooks, schedulers, so on, but soon they grew far beyond these simple functions. Same as with the PACS, the RIS requires some very basic IT skills, some basic computer literacy, and the point is that they contain private and medical data, so the access to them is limited. What is the normal structure of some information flow, some data flow between electronic health records to the hospital information system to the radiology information system, and the radiology information system communicates with the PACS, so the flow is both directional, of course, as you may imagine. Also, sometimes the radiology information system is not separated from the hospital information system, but is included as a module in it. However, usually there are two different databases because of the convenience. One for the hospital information system and one for the radiology information system, because they contain different fields. How it starts: the patients are registered in the hospital information system with the name, age, medical insurance plan, the contact phone, the address, and other stuff. And all these fields are available in the system. Also, each patient have unique identifier in the healthcare organization. This identifier is called Master Patient Index, but you may have it in some other forms. This is unique identifier of the patient. It doesn't change, and it is available for the whole network of the organization, for a given organization, because some healthcare organization may have different facilities or to have different hospitals in different cities. But anyway, each patient have one unique number for the whole organization. When the patient is registered, it is very rarely to change some data. Of course, the patient may change the address or phone. This is possible, but normally most of the data are not changed. So this is very convenient. And they have, then for the exams, of course, data for the exams are changed because modality can be different and the referring physician can be different and so on. But the radiology information system receives information from the hospital information system. And if there is no hospital information system, or due to some reason they are not connected, I cannot imagine what can be the reason, but there can be some reason to not connect the hospital information system to the radiology information system. So then, of course, data can be manually entered in the radiology information system, and this also may happen in standalone medical image facilities, because they do not need other system rather than the radiology information system. They do not have some general hospital information system usually. Similar to the PACS, RIS also have authorization and authentication and roles and logs and so on to monitor the activity and to perform the measures for security. One of the main functions of the RIS is scheduling of the patient exam. And usually this is made as there are some time slots available, they are displayed, and one may filter the display, because if the patient needs MRI, no reason to watch available slots for CT, for example. Or if the patient will visit a given facility in a given city. No need to look for available slots in a facility in other city. So there is no risk to schedule 2 patients at the same device at the same time or to overlap patient exams. Next, it is possible to lock some specific times for maintenance. For example, you decided Friday afternoon, given a date, will be locked for maintenance. Not possible to schedule patient for this time. And it is very easy to reschedule, usually just drag and drop, nothing more. Additionally to the patient's identifier, a radiology information system generates a unique identifier for the study. And usually this is called accession number. Also there is a tag in the DICOM accession number. And the radiology information system creates information list for the patient and communicates this information to the modalities via so-called DICOM modality work list. And then the modality acquire the needed data. So there is no risk to make some error in the patient data because they are provided system to system to system and no one needs to enter them manually. Of course, some corrections can be made if there are some errors noticed at any time. So after a radiologist writes a report, the radiology information system stores this report. Also, the radiology information systems may provide some statistics in the similar fashion the PACS provide, but PACS are more modality-oriented, while the radiology information systems may provide statistics not only for modality workload, but also for the radiologist workload. And for example, different can be seen different radiologists, the number of MRI readings, the number of CT readings, the number of PET readings for a given time, just to have the workload. Some systems have integrated ICD-10 list. ICD, you know, stands for International Classification of Diseases, just to make easier to fill information, to fill the reports, and not to make some mistakes. And finally, the system may perform automated billing. Also, besides the billing, the system may send electronic notice to the patients about the scheduled time of the exam, some questionnaires and requests for feedback. Even the radiologist report can be sent by the radiology information systems, but be very careful with this option to be always sure that the proper patient receives the report. So it can be better if the patient requests for a report receiving not to be automatically sent. The radiology information system saves time due to the faster electronic transfer, and that there is no need to enter the patient data again and again and again. So less paperwork, more time to do the main work, less scheduling errors, better modality management, and all these measures may lead to the higher patient throughput. And the more patient, the more benefit to the hospital or to the medical organization. And as mentioned, the radiology information system may contribute to the application of privacy and security regulations by providing access only to authorized personnel with given level of access. And you may restrict or prohibit given some activities, for example, data export. Same as with the PACS, the system requires some initial investment and staff training, but of course the staff training is provided by manufacturer mainly for the to learn the stuff about the functionalities of the system. Of course, there are some concerns about the price, investments, and so on, and there are open versions, same as with the situation with the PACS open versions. There are some lightweight versions, some paper exam version when the fees depend on the number of the exams. And there are some flexible payment schemes, other flexible payment schemes as well. So thank you very much for your attention.